Members in session. Debate continuing on private members' motion. Number 1. Any other member wishing to speak? The elected member for Bontown West.
Thank you, Mr. Speaker. I rise just to record in this House my support for the motion that the Honorable Leader of the Opposition. No, I don't need that. No, it's all right. And then paperless. It's electronic age. Just rise to support the motion that the Honorable Leader of the Opposition brought. Mr. Speaker, I second that motion because I believe it's something timely, but I just want to record for my good friend, the Honorable Minister of Health, just to remind him that there's one thing that my grandmother taught me from a young age is if fish come from the river bottom and say it deep, it's deep. Meaning that while he has been in minister for 3 months, my colleague here to the right, the Honorable Anthony Leedon, has been Minister of Health for more than 10 years. And I believe the advice he had given to this House is something that should have been considered by the government. And the reason why I say that, Mr. Speaker, is that since 1988, the Ministry of Health has been a political departure lounge. The Honorable Ezra Miller lost re-election in 92. The only minister to be re-elected as Minister of Health that started, again, has been my colleague. In 2001, I think 2000 to 2001, thereabouts, the Honorable Linford Pearson was Minister of Health. He lost re-election. Gilbert McLean took over from him after that. He lost re-election. Yeah. Mark Scotland took over again from my colleague here. He lost re-election. Ozzy was Minister of Health again. He lost re-election. And no, it was for a brief time before you took it. Yeah. And the thing is, the only other survivor, Mr. Speaker, was actually the Premier in terms of passing through that ministry. So,
And for your information, I was the Minister of Health. And I didn't lose an election.
No, that's different. I said who started but didn't finish. I said, stand corrected. The reason, Mr. Speaker, why this is near and dear to me is in 2006, I had my brush with death, where I literally almost died. Went to work one day, woke up in the hospital, and a couple of weeks after that, I was actually in Cleveland Clinic fighting for my life. The person who, when the hospital sent me home, Mr. Speaker, they told me I was pretty much good to go. The leader of the opposition came and visited me in his capacity as a friend, took one look at me and said to my wife, he's a sick man. It was actually on a Monday, Mr. Speaker. He came look for me Monday morning. By Monday evening, we were on our way to Miami. On Tuesday, Mr. Speaker, we're at Cleveland Clinic. They told me I couldn't see a doctor till Thursday. And right there in Cleveland Clinic, Mr. Speaker, on the 3rd floor, I think, something like that, Ezra pulls out his phone and dialed 911. And the ambulance left from one side of the hospital, come around to the other side to pick me up, to take me to emergency. That literally saved my life, literally. The Thursday I had my first procedure. By Friday I had major surgery. And every morning, as I see my 12-inch scar on my back, and I think of everyone who had pneumonia and emphysema that died, since surviving it, I've taken it something. No, I wasn't going to die. God had plans for me. But the thing about it is, Mr. Speaker, as I said yesterday, that there are some things in this country that shouldn't be political. And I believe that healthcare is one of them. And this is something that I think that every single member in this House has a responsibility to deal with. And despite the government not accepting this motion, I just want to record, for the record, that we still want to work with them on this because this is an issue that is near and dear to me as personal. And just to record, Mr. Speaker, to my good friend, the Minister of Health, that despite the political departure launch in that ministry, I will still be working for him to get re-election if he chooses to do so. But I just want you to know, my friend, that this is something you may need a lot of help with. Because as you can see, despite whatever you may think, the public, or in particular the voting public, has had a different view on that ministry. And as such, I would hate for you to be a casualty. And bear in mind that most of the casualties have been from the District of Barton Town. I just wanted to make sure that you don't become a casualty. So I just want for the record that we're still willing to work with you in terms of the reform. And I also want to thank the government yesterday in the SPS when they had mentioned that you're looking to expand the role of Cynical. And the reason being, Mr. Speaker, is that we did a grave injustice in this country to a lot of people. The way in which we structured our health insurance is that while we made it mandatory for the citizens of this country to have health insurance, we never made it mandatory for them to sell it to us. And as a person who has been overweight, Mr. Speaker, for quite some time, I have seen the discriminatory practices that goes on within the different health companies. And I've also seen the discrimination for a lot of senior citizens in my district, where once they have retired, they have nowhere else to go to get health insurance but Cynical. Mr. Speaker, the purpose of insurance is to spread risk. What we have done and what we're doing to the Caymanian people, Mr. Speaker, is wrong in the sense that a person can start working from 16 to 65 and for 49 years pay into a private health insurance when they're young and they're healthy. And at the time of their life, when they're most in need of health insurance, they have to go to Cynical and become a burden to the taxpayers of the country. And that, Mr. Speaker, is wrong. So what we are open for, and some of the reforms, was to look at finding a way in which we can make health care affordable and accessible to everyone. See, Mr. Speaker, we in this House have to ask one question. Do we consider health care a benefit, or do we consider it a right? If we think it's a benefit, then by all means leave it the way it is. But if we think it's a right for every citizen in this country, Mr. Speaker, then we have to do some level of reform. But the reality of it is, and you see it within the government's own SPS and even financial statements, it is qualified today, Mr. Speaker, due to the fact that the pension liability and the health care liability being in the notes of the financial statement as opposed to the face of the financial statement. And in the last 2 years, Mr. Speaker, my memory serves me right, the government health care liability itself moved from 1.2 billion to 1.7 billion. And if anyone believes, Mr. Speaker, that asking civil servants to co-pay will fix that $1.7 billion problem, it's not going to happen. So, Mr. Speaker, we have a lot of work to do with regards to health care in this country. The HSA is still the primary provider of health care. It is the government's responsibility to provide health care. And even though we do have private citizens, Mr. Speaker, that provide this service, it still does not take from the government that responsibility. One of the things, Mr. Speaker, that we have continued to do in this country is that we have outsourced a lot of the government responsibilities to the private sector. And in essence, we have privatized profits and we have socialized losses. And that is something, Mr. Speaker, that we need to fix. So despite the government not accepting the motion, and at the end of the day, the minority or the opposition will have its say, the majority will always have its way. But nonetheless, Mr. Speaker, I just want it said for the record that we're still willing to work with the government. They don't want to have a committee, that's fine. But we're still willing to work because this is a responsibility for every single member of this House. Thank you, Mr. Speaker.
The elected member for Newlands.
Thank you, Mr. Speaker. Mr. Speaker, I also wanted to rise to give my support to this motion. It's a very important motion. which I also think is timely. And I also wish to express my disappointment with the government for not indicating that they will support the motion and support the recommendations in the motion. Mr. Speaker, as my colleague from Bordentown West has said, this is an issue that should be a concern and is a concern for all of us. And it is one of those issues like education that should not be politicized and become a political subject, because it is critical to so many of our people to have reliable and dependable health care in this country. Mr. Speaker, the most vulnerable among us depend on us to address the issues in our healthcare industry, and they get it right. And I am very disappointed that the government has not accepted this offer from the opposition to work together to resolve some of these issues. Mr. Speaker, I have major concerns with health insurance in this country. I know a large number of seniors who are struggling to get proper health care because they cannot afford health insurance. And there are many younger individuals who are paying premiums on a lower level of coverage because that's all they can afford. And again, that coverage does not provide value for money. Mr. Speaker, I've spoken to many private doctors, in particular leading up to this election. During my campaign, there are a number of doctors who live in Newlands who met with me and gave me some insight into some of the concerns in the healthcare industry. And I won't go into those in detail, but I will say that there is a willingness on the part of the private practitioners to work with us as well. I was even advised by a group of doctors that they were willing to accept the fee structure that is in place between the HSA and Cynical so that they could start working with Cynical clients as well and alleviate some of the strain on the government institution. Mr. Speaker, I'm aware of, through my constituents, concerns with getting medications at the hospital pharmacy. They go in, they see the doctor writes a prescription. When they get to the pharmacy, there's no medication. There are major issues with getting referrals, and I understand sometimes the doctors have to deal with patients who obviously are not medically trained, but feel that they need a heightened level of attention that they're not getting at the HSA and want the referral. And sometimes they don't have a good reason for it. Other times they do. But there's always been that issue that my constituents come back and complain to me about getting referrals in a timely manner. Mr. Speaker, I recall when I was the Premier's counselor that I had a conversation with some of the ministry staff about the level of premiums in this country and what we could do about it. And I was surprised to hear the minister today say that there's going to be an actuarial study completed looking into the level of premiums and level of care provided by these plans, because I was told that such a study would be a huge undertaking and very expensive, and the number of actuaries involved would make it something that was impractical to do at the time. So I'm pleased to see that that mindset has changed, because I will give you an example, Mr. Speaker, of what some of our people deal with. Just taking the SHIC plan, the average basic SHIC plan to health insurance coverage. Routine visits, going to see the doctor for the flu or whatever ails you. The coverage, the annual coverage for that under the SHIC plan is, I think, about $400 a year. For wellness and so forth, there's an additional $200 a year. For a 30-year-old, the monthly premium is $138. Mr. Speaker, that works out to 1,000, as my colleague has said, $600 a year coverage, and you're paying upwards of $1,200 a year. That means the rest of that money goes in the pocket of the insurance company. Same thing if you look at someone who is 65 years old and over, if they're on the SHIC plan, they're paying $167 a month on average. That's about $2,000 a year for that $600 coverage. I don't think anywhere else in the world, Mr. Speaker, you can buy insurance and you're paying more than the benefits you receive. Now, I understand there are other benefits thrown in there for emergencies. I'm not including those because the average person probably doesn't have a heart attack every day. But just the general day-to-day coverage that we depend on. And these companies are licensed by the Cayman Islands government, Mr. Speaker. That means it is our responsibility to get this right. These insurance companies are operating as licensed insurance companies in this country. Mr. Speaker, I'm aware that there are issues at the HSA and throughout the medical profession that need to be addressed with urgency. We have too many of our senior citizens who are uninsured, can't afford insurance, and who do not get routine medical care to prevent catastrophic incidents occurring with their health. I have to join with my colleague from Bordentown West to implore the government to consider this being something that this entire House can work on together. Premier said yesterday that the opposition's job isn't to just complain, that we should put forward solutions and suggestions that are useful. And this is one, Mr. Speaker, and it escapes me why the government doesn't grasp this opportunity to work across both sides of this House to get this right. Too many of our people depend on this, Mr. Speaker, and depend on us. So, again, I am disappointed that the government has decided that this side of this honorable House has nothing useful to contribute in this area. But we will continue to advocate and push for reform and change in this area. And I hope that that attitude will, as the memory of the election fades and time moves on, that attitude will also fade, and there will be a more open approach to working on issues such as this that I consider of national importance. None of us are here to play politics with health. We all want to see it done properly, Mr. Speaker. So with those few short words, I will again offer my support for this motion, and I will ask all members of this House to consider supporting this motion. It is critical that we demonstrate to our constituents and those who put us here that we're taking this seriously. Politics aside. Thank you. Thank you.
Does any other member wish to speak? Does any other member wish to speak? Does any other member wish to speak? Honorable Premier.
Thank you, Mr. Speaker. Mr. Speaker, as I sat here and listened, I wondered if members of the opposition had fallen asleep while I was delivering the government's contribution to the motion to adopt the SPS. For I devoted, on behalf of the government, a significant part of my contribution to explaining what the government's plan is with respect to health care improvements and to access to health care. The government has a plan, Mr. Speaker. I have been around this process long enough to understand that if you send anything to a select committee, you commit it to abject failure. In the almost 17 years I've been here, I've never known of one select committee to complete its work and produce a report that ever resulted in anything. And I am not going to hasten the departure of my Minister of Health, as his friends on the other side seem to suggest they want to happen, by tying his hands and the government's hands and being held to ransom by a select committee which will sit, and in the meantime, he as Minister of Health will be required to do nothing for the year it takes or more of that committee to sit and chat, if it ever meets. For getting a quorum for a select committee, it's legendary. Those of us who have been here for a while understand how these things work. If the opposition want to really prevent a minister from getting something done, they force him down the road of a select committee, and the work of the committee is supposed to carry on, and that particular issue and subject never, ever really gets addressed by the minister. We have a plan, Mr. Speaker. We more than welcome what the opposition has to say by way of contribution to it, but we are not going to be held to ransom by a select committee. We are charged with the responsibility. The minister is charged with the responsibility for health in particular, and he will be taken to task by the opposition and by the broader public when things don't get done. The opposition will take no responsibility for that. So we understand very well how serious this matter is. We do understand it is a matter of national importance and priority, and we are going to get on with the business. Mr. Speaker, our views about health care on this side in some ways are diametrically opposed, certainly to those that I have heard proposed by the leader of the opposition over many years. We do believe, Mr. Speaker, that Health City is a critical and integral part of our health care apparatus. We are not going to support proposals which aim to lessen its importance in the system or perhaps ultimately to close it down. We are not going to dismantle the health practice law and create more hurdles to doctors being able to get registered and medical personnel generally and to practice there. All of which I've heard proposed at one point or another by the leader of the opposition over the last 8+ years. So, Mr. Speaker, you will begin to understand some of the concerns that the government has when we hear a motion such as the one that's just been proposed, being proposed by the leader of the opposition. I know, Mr. Speaker, at one point he was Minister of Health and apparently subject to the same syndrome that tends to affect most health ministers, and ushered out of the departure lounge. And that he is a trained and experienced pharmacist and indeed has qualifications in hospital administration. So I'm not for one moment seeking to in any way not accord him the respect he's due at that experience and education. But I'm saying in terms of policy, we appear to be diametrically opposed on some levels. So we are, for the time being, the government, and we reserve the right to be able to make these critical policy decisions, albeit with whatever input we are able to obtain from the opposition or indeed other experts in the medical field. For neither the current Minister of Health nor myself, the previous Minister of Health, have any qualifications in this field. But what we are, I believe, on this side, qualified to do is to make judgments based on advice about the direction that we should move in terms of the continued development of healthcare, and as important, if not more so, access to healthcare by a broader cross-section of the Caymanian community. So we are working on both fronts. How we can expand and make more affordable health insurance to the vulnerable in the community, and indeed to the other demographic which is currently excluded from Cineco coverage, the healthy, the young and the healthy who are not civil servants or public servants and subject automatically to Cineco coverage. As I said, I spent some time explaining in the contribution I made yesterday what the government plans are in that regard. And I would invite the opposition to spend a little more time studying what it is the government is saying, and to say to them that they can look forward to more detailed proposals and position when we come to the address, the throne speech, and the budget address. So I wish to assure the listening public and the House that the government is giving this very urgent attention. What we are not prepared to do is to have our hands tied by a select committee when we are already well on the way to having the necessary discussions and moving the process along. I invite the opposition to make any written proposals they wish. If they wish to sit down in a committee with us to talk about these issues, we're more than willing to do those. But the formal process of a select committee and all that entails is not one that the government is prepared to accept. I thank you, Mr. Speaker.
Does any other member wish to speak? Does any other member wish to speak? Does any other member wish to speak? Does the mover wish to reply?
Thank you, Mr. Speaker. Mr. Speaker,
Elected member for Northside.
it never ceases to amaze me how the PPM government can react to sensible proposals. What does this motion propose? Proposes a select committee. How is the select committee made up? 4 members from the government, 2 members from the opposition. What would the quorum of 6 people normally be? 4. The government could meet in the select committee and do its work, even if nobody from the opposition showed up. But you hear all of this red herrings drawn in about how select committees are non-functional and how select committees can't possibly work. Especially in that case. And I could get to that, the select committee on the separation of parliament recently. Mr. Speaker, you will recall some of the best legislation produced in this country was done through the select committee process. The great and promising changes to the immigration law, of which the current premier was a vocal member of the select committee, came out of a select committee of this house. But more importantly, Mr. Speaker, what would a select committee bring to this problem that does not now exist? It would bring focus, and the public would be able to hold us responsible, and we wouldn't be able to blame the civil servants because it didn't happen. It would bring urgency to solving the problem because there's a deadline in the motion, 30th of June, 2018. It would bring commitment from both the government, who have the majority on the select committee, and the opposition, even though they have the minority, to put in place the legislation, the policies, the procedures, and the resources to implement those things, which no ministry can bring. But since the Premier believes that anything done by select committee is an abject failure, I could spend the better part of 2 hours pointing out all of the good legislation that came out of select committees when parliamentarians were willing to come to the select committees and when they were willing to participate and when we allowed the stakeholders to come to the parliamentarians and present it, and they couldn't cut private little deals behind the corners because of their own personal and private profit incentives to get certain changes to these healthcare legislation, and particularly health insurance. But, Mr. Speaker, let us look at what the current system that has been relied on has generated over the last 10 years. Let's take a look at it. The Minister of Health said, things are okay. We made all kinds of good changes in 2013. What are the results of those changes? I stood here in this Legislative Assembly, cautioned the government about the changes and what the potential problems were going to be. I predicted that the changes that were making to the health insurance law in 2013 was going to drive up premiums and reduce coverage. They dismissed it. Mr. Premier says that in the last 8 years, I wanted to close Health City. I wonder where he got that from. But remember now, his profession is a lawyer. So they have the ability to argue both sides, and whatever side you pay them to argue, that's what they argue. Very effectively. In fact, their success is judged by the ability to argue whatever side they're paid to do. So I understand his argument. But you can't twist facts. I have never opposed the introduction of Health City. What I have said is we have to be careful and it shouldn't have exclusivity. And I always use the reference. Imagine if when we launched the dive and tourism industry, we had to give Bob Zotto all of the possible concessions that you could possibly get and exclusivity. Where do you think the dive industry and the tourism would have had? Or if we had gave W.S. Walker exclusivity on the financial services. My position has always been, it is open and competitive. I will say publicly that Health City does come good work. Has helped a lot of Caymanians. I will also say that it is all not as kosher as they spend every Monday on the radio making people believe. Acts. They claim that they have 100% success. I would argue otherwise. You doubt me? Ask James Parsons that works at the port. Ask Bo Miller. Ask Ben Thompson. And I could go on. The problem we have with Health City is the inability of the government to have any oversight or any regulatory authority over what is done there. And we are eventually going to pay the price through lawsuits by non-Caymanians because we can't do that. You know. Just give it time. But the worst thing that the Premier could ever accuse Ezra Miller of wanting to do is to dismantle the health practice law. Me, who has spent my whole life trying to improve the standards of healthcare in this country. And anything that happened in this country concerning improvements to healthcare, in particular the regulatory side of it, post-1974, got my footprints around it, something about. I wonder if the Premier can say the same thing about the legal profession. Mr. Speaker, you know, you was Premier. I stood up in here and opposed the barn door that was being kicked into the side of the regulatory authority to facilitate Health City. I told the Minister of Health it was the worst piece of legislation I had seen come to this Parliament in my tenure here, in terms of what I believed it had the potential to do to the regulatory regime for healthcare in this country. And there was no need to do it. The doctors that work at Health City, I'm confident, could pass any exam that we require them to do to have been registered under our regulatory authority. We could have simply went and done the CAMC exam. The only thing that would have been in a barrier to them would have been language. And if you can't speak enough English to pass that exam, I would question whether you can speak enough English to practice in an English-speaking community. And your total marketplace is English communities, meaning United States and Canada. The hard, cold facts here, Mr. Speaker, is the reason I brought this motion is because not me, the Auditor General and the healthcare professionals in this country says that the health ministry is incapable. Administrative staff in the health ministry are incapable and unqualified to put in place the necessary policies and procedures to bring about the kind of changes that need to be done. What was their response to this document? It's obvious that the members of the government haven't read it, Suggest on a read over the weekend. Because all of them, like me, getting up to the age when I get sick. And I want to know when I go up there with a cynical card. Understand a chance. Their response to most of the recommendations were recommendation noted. We had public hearings down here. They came down here. We gave them the opportunity to defend it. It went so bad, the deputy governor went to one of my committee members, accused me of setting up the staff, and that I should bring them back to give them an opportunity to defend it again. I told him, be careful. Be careful. Now, Mr. Speaker, let me tell the Premier and his government, I have sat here for 8 years and left as a healthcare professional and left the government alone to bring forward solutions and improvements in healthcare. And I jug them. I remember when I get the finance committee. And that's what Roy said, right? And I jug them in the budget debate to encourage them that they should look at this, they should look at that. And when they bring it here, I provide a critical analysis and constructive criticism to it. Them days done. Every meeting of this house that occurs, I will be bringing motions to improve healthcare in this country. The Premier says he got out of how many pages his speech was? 20 something? Half a page on healthcare. There's not more half case on healthcare. A little bit more about Seneco and a little bit more about a couple of things. No specifics. No specifics. I could put plenty of specifics in it, but I left that for your government majority to come up with the ideas. And if I happen to be recommended by the opposition to be a member, I would offer constructive criticism of what they bring in. But here is what the Minister of Health said that worries me. He lauded the fact that the changes to the 2013 shake plan were so good. They removed the 25,000 episode of sickness that they introduced to improve the profits of the health insurance industry, because you limited it. I don't know how they determine what's an episode of illness. That's a very strange thing in healthcare vernacular, and particularly in the payment regimes and stuff in the field, right? But that is similar to the insurance introduced the Caymanians, the aftermath of Hurricane Ivan, you were underinsured. Similar kind of thing. Is the people, you understand where I'm coming from? You understand how the fool, no? Said that the needs are being met. All of them changes to that, I will tell the current Minister of Health, because what Jim had brought him, nothing more than window dressing and smoke and mirrors. You heard the Deputy Leader of Opposition, the member from Newlands, tell you the numbers he got from a local insurance provider. Today, I was here when he made the phone call. That the government considers a great improvement in healthcare. The only benefit you get out of that plan is if you happen to be hospitalized. But normally, in healthcare administration, and in particular those people who should be responsible for policies and procedures in healthcare, try to reduce hospitalization. The more they can treat as an outpatient, the better off it is. Let me give you two instances that have been brought to my attention recently of what that plan does for people. Doctor prescribed blood pressure medication for a patient. Goes to the pharmacy. They don't have the copay. The pharmacy refuses to give them the medication. 2 days later, no blood pressure medication. They blast a blood vessel in the brain, brought into emergency room, cranial burr involved, all sorts of stuff. $50,000, $75,000 expense versus $10, $15 in copay. That's what the government is satisfied with. Give another example. Lady, doctor discovers a lump in her breast, refers her to the surgeon. Surgeon schedules surgery to remove the lump for biopsy purposes. Patient told the patient her copay is $900. Said she don't have $900. Mind insurance paying the balance with 8% now, you know. She can pay $200 a month. Nope, can't accept that. A couple of weeks later, when she can afford the copay, she gets the surgery, and the lump is cancerous. It happened. No urgency. We don't need a select committee. Focus on this. The minister mentioned the National Health Policy and Strategic Plan. 4 years the minister took to put this together. Tabled the 13th of March, 2013. The plan expired this year, 2017. The minister said, we were told that in Public Accounts Committee, if you read the report, you will see the answers in there. They're going to review it. I said, what you going to review? Are you going to review what is proposed in it? Because you can't review the implementation. You don't have no implementation plan. Table in this house. Solution to the problems. They're going to review it in the latter part of 2017. So they're going to add personnel to the practice regime so they can get the work done. I believe the Health Practice Commission has been asking for them staff for at least 3 years. They're still talking about we gotta add them. But the Premier says it is Ezra Miller that wants to destroy the health practice law. Oh, I know. That's why he replied. I can get to that, don't worry. And I get there yet. I don't need no water. I got my salt in my pocket. You don't see me licking my finger. Again, the new thing about medicine, they would know that the last thing you should do for a dry throat when you're speaking is to drink water, because it washes away what little saliva that the body produces away. You'd be much better off if you dipped in a few grains of salt, put on your tongue, which would stimulate the saliva to produce more liquid.
Good to know, but that's not in the
Mr.
in your
Speaker.
motion.
Mr. Speaker,
I am trying to keep everything in a balance. The motion does not talk
yeah,
about-
but your balance kind of leaning the other way, so just
No.
Okay, all right, just
I don't know where this thing about saliva came in at.
obviously he wasn't listening because I preempted the statement by saying if they knew anything about healthcare.
Still
But
not
anyway,
in- I'm not on board.
I
that being in the motion. Carry on, member, please.
yeah, don't worry. I've been here long enough to know the tactics of disruption and what it hopes to achieve, but not this evening. Calm. I don't need no
I just
water.
hope you're not saying that the chair is trying to disrupt.
I hope I didn't hear this correctly from the Minister of Health, that he's looking at a special youth plan for health insurance for the healthy youth because they should get a reduced premium. Because, Mr. Speaker, that will completely destroy the whole precept and concept of health insurance. The problem we have in this country right now, and particularly in Senegal, is because government is only insuring sick people. And we allow the private sector, although the health insurance legislation, the one that was passed in this House in 1992 made it clear you could only sell group insurance. That was repealed. The one that was passed in 1998 kind of indicates you should sell group health insurance. But what the insurance companies actually sell is individual plans discounted through marketing and discounts for numbers. Two different things. Because when you do group health, you insure the healthy people, usually the younger people in the workforce, and the premium is equated across so that the younger people help bring down the premium for the older people. Because you can get old one time too. And somebody who's younger is going to be paying a premium to help your premium be down. But you see, somehow we believe some of us are going to be frozen in time. And we not get old. Because that would be even more disastrous than some of the changes that were made to the health insurance recently, with the Premier being responsible for health. The Minister of Health said that their current registration and regulatory system is very robust. I agree with him. But there are changes that need to be made to that regulatory regime to keep it up to date with what's going on in the medical field. When those laws and regulations were written in the 70s, 80s, and 90s, most Caymanians who did medicine went to the University of West Indies and they did an MBBS, which usually included a minimum of 3 years of clinical work. They came back and be licensed as a general practitioner. In modern day medicine, in particular at the University of the West Indies, because of the demand for spaces in the medical program, the University of the West Indies is no longer able to provide space for Caymanians to do those clinical services. And instead of us accepting offers that were made by Caymanians, doctors eminently qualified, persons like Dr. Neela Panton, who has full professor status at Vancouver General and Vancouver University, and who offered in writing to assist this government to train Caymanians. I don't know whether they turned him down, because to the best of my knowledge, he hasn't gotten a reply. But we have 10 Caymanians at the HSA who are begging for assistance to specialize. Because you see, today, when you get an MBBS in the medical field, that is looked at as how A levels in biology and zoology used to be looked at in the 70s and 80s. You are now prepared to enter medical training for specialization. Because in most countries, even GPs now require specialist training and board certification. But what are we doing? We tell the Caymanians, go apply for a $20,000 scholarship. And it is their responsibility to get board certified. Meantime, the HSA pays $900,000 for 6 apartments to house locums, most of the specialists to come in to visit, to do the work that qualified Caymanians could do, who could be trained for less than $100,000. But we're okay with that as a government. The HSA. The minister just tabled the June 2016 financial statement. Public Accounts Committee reviewed the 2014 and the 2015 financial statements last year. One of the things that we recommended was that as a matter of urgency, they clear provisions for bad debt. Accounts receivables. Gross accounts receivables, $122,324,869 from 104-bed hospital. Some of it, that includes, because at the time when we made the recommendation, the allowance for bad debts, this statement is 94 million, up from 8 million in 2015. In a country that has compulsory health insurance, and the government has more little votes in its annual budget to subsidize this place, then you can shake a stick at. We have votes for uninsured. We have votes for people whose insurance run out. We have votes for indigents. We have the civil servants are handed through Seneca, right? The health insurance premium in these accounts to the HSA. Who, I believe, have some form of self-insurance, and above a certain level, they buy health insurance. $2,517,568. How much staff they got? 104-bed hospital, or 120 beds if you stretch it to the absolute limit. 20 senior managers. According to this account, it looks like these accounts, it looks like they mark up medication for Caymanians 400%. 11 million in cost, 22 plus million in income. You go to the pharmacy, and Mr. Speaker, I don't talk what I don't know, I go and experience these things for myself, because when people make these kind of complaints to me, I think it's impossible to believe in this day and age that those kind of things are happening to people. So I happened to be in town one day and met my father at A.L. Thompson's and said he needed some medication for mother. So I said, and he was going a road trip. So I said, give me, I'll go to the hospital and get it. So goes to the hospital and walk in the pharmacy and there's 3 lines. So I go and I get in the first line and in the bottles for refill. Do you have a card? No. But that's a refill. You must have it in the system. But that's the way it works here. Okay? I suggest you go and find it in the system. Because I come and get the medication. So they went down the back, they come back. Yeah, we found it. Okay, you can review it. Okay. Go ahead and review it. No, sorry, you got to get another line. Come another line, get another line. Now these things are 2 feet apart, these lines. Hand in the prescription. Pharmacist looks at me and says, sir, can you come back tomorrow? I say, are you mad? What do you mean, sir? I said, did you look at the medication? It's insulin for diabetic. I want it, and I want it now. Some senior citizens in the back. And I got a match at today. So I turned around and I said, how many hours you all been waiting on your prescription? Some of them waiting 4 or 5 hours for the prescription to be filled. Because they don't have transportation to go north side of Easton and come back. Mind you, I count, I think, 4 people in the back, they're filling prescriptions. I look at the lady, I say, when I ran this place, a pharmacist couldn't fill a prescription in 10 minutes. I fired him. So I am here. I want my mother medication, and I leave until I get it. Huff and a puff. I understand now, This is not like in the days when I worked at a hospital where we had to buy medication, tablets, and bulk them. We had to count them out every time. Right? And we had them little triangle counters. If you have to shake them, you knew if you had 5 on one side, exactly how much that worked out though. Right? This is all pre-packaged. Some bit mostly in Spanish. And all they got to do is stick a label on it. stand up there. I see the person that took the medication from me come and give it to another person at another window 2 feet away. No, sir, you got to go get in that line to receive it. Oh, okay. Well, I can reach you from here, you know. No, so you have to go and get in that line. Okay. Get out, go in the line, and take the medication. I go home. The fundamental problem today at the HSA is the chief operating officer, the chief financial officer, the chief nursing officer believe that the doctors are there because of them and not the other way around. That they are there to provide support and resources and materials for the doctors that deliver health care. You think you're going to get the kind of what I talked about yesterday, evolutionary and revolutionary solutions that we need to health care from them people? But I'll leave it alone. I'll leave it alone. Trust me, when I bring it to you, I can tear it apart. And I am going to tear it apart out down the street. From this moment on, you all can consider me an advocate for changes in healthcare in this country. And since I won't do it in a select committee where we can work together on it, I'll do it at the public level. Because it has to be done. The people of this country deserve better than they are getting for the millions of dollars in taxes they're paying for it. And it is our responsibility to do something about it. But you haven't done it so far. Because if you believe that the things I just talked about there is good health care, God help this country. But Mr. Speaker, and they do consult the very people that's going to affect that it's going to affect. They come up with this harebrained scheme. You can't carry your medications to your containers to the clinic the day before, and when the pharmacist comes to Easton or Northside or Bordentown, he fills it. And if you can get transportation to come back that day, or you can get somebody to pick it up for you, or the nurse could deliver it to your house for you when you come on a house call. They put in a rule that can't happen. You couldn't go to the Northside clinic for about 6 weeks to get medication unless the pharmacist was there and a cashier was there. That only happens Tuesdays and Friday. The nurse who goes out and do home visits find your medication containers empty or going to expire the next day. We're told she couldn't bring them to the clinic to get the pharmacy to fill them. Why? For financial reasons. Hello, all these people are free. All of these people that you're putting these stupid rules on are free. Well, I managed to get that changed. But again, this is the kind of rationale, this is the kind of genius that exists currently. And Mr. Speaker, I was hoping that we could have put together a select committee of this House, which could have brought the focus, which could have brought the urgency, which could have brought the commitment to doing something about healthcare. And I'm truly disappointed that we're not taking that opportunity to do so. But we'll see what they succeed in doing with the promises for healthcare. I remember all of that they promised today. All that they promised there. Somehow, the Minister of Finance can do that $54 million additional expenditure what Jesus did with the 2 fishes and 5 loaves. Okay, I can take that kind of miracle for you all to get 40% of that which was presented yesterday in an EPS. Let's say you're only going to spend $54 million more on recurrent expenditure next year than we spent in 2016, It's much less in terms of more than what you spent in what you spent in this year.
Honorable member, how are you relating that to the motion for health? Gladly. The motion is that this legislative assembly considers establishing a select committee of 6 members, 4 from the government and 2 from the opposition, to review the current policies and legislation governing healthcare and make recommendations as to ways to move both accesses to and quality of healthcare while reducing the cost to consumers before June 30th, 2018. All those in favor, please say aye.
Aye.
Those against? No.
Mr. Speaker, may we have a division, please?
Clerk, divide. Just to make certain, I thought I heard more no's. So we'll have the division.
Honorable Alden McLaughlin.
No.
Honorable Moses Kirkconnell. Honorable Juliana Connolly.
No.
Honorable Dwayne Seymour.
No.
Honorable Roy McTaggart.
No.
Honorable Joseph Hu.
No.
Honorable Tara Rivers. No. Honorable Barney Bush. Captain Eugene Ebanks. Miss Barbara Connolly.
No.
Mr. David White.
No.
Mr. Austin Harris.
No.
Honorable Ezra Miller.
Aye.
Mr. Alva Saku.
Aye.
Mr. Kenneth Bryan.
Aye.
Mr. Anthony Eden.
Aye.
Mr. Christopher Saunders.
Aye.
Mr. Arden McLean.
Yes.
The results of the division. Ayes, 6. Noes, 9. 3 absentees. The motion is negative. I'll take a short break at this time. 15 minutes.